Hi everyone, hope you guys are all doing well today. I wanted to come on and talk about PCOS and bloating. This is a common symptom that a lot of women with PCOS have. I've also experienced a lot of bloating when it comes to PCOS, so I'm going to talk a little bit about some of the causes today and also let you know about some of the treatments that I've seen can be really helpful when it comes to bloating and PCOS. If you have any questions at all, please drop them in the comments below, and even if you're not watching live and you have questions later on, I'm more than happy to help answer any of them even afterwards. So when it comes to bloating and PCOS, there's a few things you really want to consider. The first thing is food sensitivities. So oftentimes we do see that food sensitivities can cause bloating and PCOS. The two most common food sensitivities that I've seen can really impact women with PCOS is, thanks Brooke, that's really sweet of you, basically is dairy and gluten. So dairy can really cause bloating, gas, even fatigue for a lot of women with PCOS, and also diarrhea and constipation. So a lot of digestive issues can be seen when it comes to dairy products. So oftentimes women believe that they're sensitive to the lactose in dairy, which it's very possible that they are sensitive to the lactose, but they can also be sensitive to the protein that we see in dairy, which is called casein. So, really working to figure out if a dairy sensitivity is there can really be beneficial. The second thing is gluten. Gluten can also cause digestive issues, especially bloating. So if you are experiencing bloating and you're consuming gluten products, so gluten products would be anything that has wheat in it. So pasta, pasta, and also, bread, obviously bread. I haven't had gluten in a while. So pasta and bread products. Rice is actually gluten-free, and oats are also gluten-free as well. So dairy and gluten are big sensitivities when it comes to bloating. The best way to figure out if you have a sensitivity is to actually remove dairy and gluten from the body for at least 4 to 6 weeks and then reintroduce it back in to see if it actually causes any issues. And keep in mind, it doesn't necessarily have to be digestive issues. It could even be headaches, it could be acne, it could be the bloating that we described, that is digestive, but also even pain. So keep that in mind when we're kind of coming up with figuring out if you have a sensitivity to gluten or dairy. The second thing is dysbiosis. So what dysbiosis is when there is an imbalance between good bacteria and bad bacteria. Also an overgrowth of candida, which is yeast in the gut. So everybody has yeast in the gut, but if you have an overgrowth of candida, this can also impact digestive issues, especially bloating. So dysbiosis, definitely, we see bloating with that. We can see other symptoms associated with dysbiosis, like other digestive issues, especially sometimes even pain. So you do want to see, maybe get somebody to help you, like a naturopathic doctor like myself, to figure out if you have dysbiosis. And then the other thing on top of that is leaky gut. So if you're finding that you're eating healthy foods and even you're getting digestive issues, it could mean that you have leaky gut, and oftentimes leaky gut comes from when you're sensitive to gluten or you have celiac disease as well, because gluten can actually break down the bonds between the cells that kind of hold the small intestine cells together. They're called, what happens is the gluten sensitivity can actually increase something called zonulin, and zonulin can actually break down the bonds in between the cells that hold the small intestine cells together. Once that happens, this opens up, and now the food particles can go in between the cells, and that can cause inflammation and can impact the immune system. So we do want to assess for leaky gut and also dysbiosis and candida. And then last but not least is a hormone imbalance. So oftentimes we're looking at estrogen and progesterone here. And if there is any issues between the two, especially just the ratio between the two, even before your period. So if you're getting bloating before periods, and that's where it usually is the worst, you do want to look at a hormonal imbalance, because that can also cause water retention and then end up causing bloating, which is not a fun PMS symptom to deal with, but definitely something to consider. And then when we're talking about treatments, so first things first, when we're talking about food sensitivity, obviously we want to remove the foods and also heal the gut. And healing the gut can also help with dysbiosis. So when we're talking about dysbiosis and candida, one of the biggest things is obviously putting in a good quality probiotic so we can overpower that bad bacteria that's in there. We might have to do some killing of the bad bacteria as well. So if candida is present and it's overgrown, we do want to starve the candida of, sugar and wheat products, and then also maybe put in some things to help kill that yeast that's sitting there. So things like berberine is something that we can use, or oil of oregano, but be careful with that one. It kills everything in the gut, even good bacteria. And then things like garlic, caprylic acid is a really nice gentle way of killing yeast. So many options there in terms of doing a candida cleanse can be really helpful. And then leaky gut, which is basically, healing that barrier in the small intestine. So things like glutamine can help here, obviously a good quality probiotic as well, but then also removing the food sensitivities to make sure that we can actually, remove the foods that are causing the issue and then heal the gut after that, which is kind of how we treat gut health. And then when it comes to hormones, we do want to look at estrogen and progesterone and see kind of what's going on with the two before a period happens, and then, helping to support healthy ratios between estrogen and progesterone. So maybe we're supporting the second phase of the cycle, which is the luteal phase, with things like magnesium, vitamin B6, even calcium can be helpful here. But then also, maybe we're putting a little bit of bioidentical progesterone in to help with that estrogen and progesterone ratio. If estrogen is really high, we're looking to see how do we help with estrogen detoxification. So things we can do for estrogen detoxification are things like exercise, because the two ways that we remove estrogen effectively from the body is through our sweat and then also through our healthy bowel movements. So making sure bowel movements are healthy, and then also making sure that we're moving our body and sweating so that the liver can actually do its job to remove estrogen effectively from the body. So I hope this was helpful. Just a little bit of talk about digestive health this morning on Friday. I hope you guys are having a good week here in Canada, and I'm sure a lot of you are also going through daylight savings this week. I know I've been affected by that a little bit, waking up at 5 a.m. for example. So I hope you guys are all doing well and surviving the time change, and happy weekend. Take care.